all of a sudden one of the team members would just, have another aha moment and say, oh my goodness, we're not going to need to deal with that anymore. This is going to fix that problem too. And all of these problems that we had been carrying for 30 years and embellishing upon, it was just thrilling for us to know that we could really adopt a standard process and move this product into the mainstream at CooperVision.
Before we really started focusing on this project, it just took longer. Our team was primarily focused on data entry for the most part, entering all these invoices. I knew in my bones that there was a better way to do things, and it was just a matter of really investigating it. And the thing that's fantastic about it is for every invoice that we bring in electronically, we're saving 22 minutes, soup to nuts.
I wasn't hearing about a lot of errors in the ED. When I went down and interviewed the staff, the leadership there, I said, hey, I'm not seeing a lot of things coming through our reporting system. And I basically got an earful. Well, why would we put anything in? That system is hard to use. We don't have time to fill out a 6-page report. I developed a telephone line that staff could pick up and report into. And little by little, their culture began to even embrace performance improvement in a stronger way.
We found out there was over 1,100 missing dose requests. So that's time that nursing has to take out of their day to ask for the medication, time pharmacy has to take to redispense medication, all of it leading to a delay in patient care. So there was just so much to learn in between the two groups, and there was a lot of aha moments. And it was that communication, breaking down those walls, that we were really able to improve our relationship. And when our departments, which are two huge forces in the hospital, work together, the patient benefits tremendously.
So we came as a group and we decided to focus on Clostridium difficile. The center is the coordinating center, but the work has been done by the 4 hospitals. So Highland Hospital, Strong Memorial Hospital, Rochester General Hospital, and Unity. Even though health systems are competing for market share and so forth, this project got people to not compete, to work together, and to reduce an important healthcare associated infection, and that is really associated with a lot of a high cost and high morbidity and mortality.
Our patients had always received about the same amount of blood that patients throughout the country received, which was always very good. What we wanted to do was see if we can break through barriers that others were not able to break through and bring that number down even lower. And so we have. And so as it relates to individual patients, the benefit that they have is that they're receiving less blood from our operation. But that's only the tip of the iceberg, because if you're the kind of organization that can fix that problem, then you're the kind of organization that can fix just a myriad of problems. So we use our same thought processes, our same technology throughout the entire system to just tackle one after the other, one problem after the other.
We are committed to providing a world-class training program to our staff. And it starts off with educating our employees on our routines, our procedures. But we work in an industry where we're interacting with clients, we're interacting with our clients' customers. And we have to go above and beyond with just our routines and procedures when it comes to our training. We need to provide training on how to communicate more effectively.
Now, the idea is when the patient walks in the door, they're registered, they need to be seen by a provider, an MD, a PA, or an NP within 30 minutes. So we were able to mobilize resources to have our providers placed up in the triage area, but we also were focusing on our quality delivery. So we brought our nursing staff up front near the waiting room, and they were able to execute orders expeditiously and get the sickest patients seen the quickest. It's not the patient that you're necessarily seeing right in front of you, it could be the 5th person behind them that just walked through the door. In that global picture, that I think allows staff to really engage in the big picture care dynamic that we're seeing in the emergency department.
We had a problem in the laboratory where we weren't able to produce results on specimens coming in from our pediatric division. Some of these babies weigh as much as 4 sticks of butter, and to repeatedly poke their heels is pretty traumatic for the baby, for the parent, for the lab, for the nurse taking care of the patient. So that's the method, and unfortunately, every drop of blood counts in a baby that's that small. The observation was really key, really key in everybody coming together and looking at what were we doing, because according to our procedures and policies, we were doing everything right, but clearly we were missing something. Lots of things were improved through the process in many areas. The lab saw efficiency, the floors got better turnaround time, we saved some money. What we really saved was patient care. We really made a difference with the babies.
I think for families, they're really looking to us to be experts and to provide them answers and support. And they need these decisions and they need this placement now, oftentimes, because they are in a state of crisis. The primary problem was that the time it took us to make a decision regarding referrals for our residential programs on our Monroe Avenue campus. So by allowing a point person to be assigned, it provides that point person with an opportunity to complete 4 crucial steps in the process, which then allows anyone else who may need to work on that referral process or work with that family to be well informed at the point of that handoff.